In the beautiful area of Bena, Minnesota, 40 Army Reserve Medical Command professionals came together with Leech Lake Indian Reservation and Cass Lake Indian Health Service to set up a clinic for the local community at the Bug-O-Nay-Ge-Shig School. For their 2-week annual training in July, the 7218th Medical Support Unit, based out of Louisville, Kentucky, worked to provide medical, dental, and eye care to a community in need, where health care is available for the tribal population, but care for residents off the reservation can be more difficult to access. Brigadier General Joseph Marsiglia, AR MEGCOM's Deputy Commanding General, witnessed the good his soldiers were doing firsthand.
I was able to speak to a young couple who were here to receive dental services, and I asked the gentleman, I says, how long did you have to wait? He says, I've been here less than an hour. From the time I got here, in less than an hour, I actually saw the dentist, have had my fillings, and I'm going home. And so that's fantastic. That tells a story right there.
The 7218th provided medical services as part of the Department of Defense's Innovative Readiness Training, addressing community needs while supporting the Army Reserve's mission essential training requirements to ensure individual and unit combat readiness. Sergeant Eric Eaton believes this IRT mission is not the typical annual training mission he is used to.
I think it's a great approach. I think that it's a good idea for the reserve. So to be able to get hands-on training to give back to the community at the same time, it's something that you don't get.
Sergeant First Class Joseph Dudek, the mission non-commissioned officer in charge, also believes this was a great annual training experience for him and his unit.
But what better way to serve a community that allows us to come in here and practice and train real world instead of a range. But I was super excited to be able to do something in my own backyard. To be able to go home when we're done, right? And have that feeling of accomplishment for somebody that you can look at and you know that I may run into him at a Walmart next week. You know what I mean?
Army Reserve Medical Command has made a difference in many communities throughout the United States in 2018, supporting 4 different IRT missions in the states of Texas, Illinois, and Minnesota, helping over 4,000 people by providing more than 7,000 different medical services to include tooth extractions, sports physicals, eye exams, and glasses. For medical professionals like Major Jamie Schaefer, these opportunities to serve are fulfilling and make her appreciative of what she has.
After being here and seeing and taking care of some of these people and just looking at sometimes the way they live, and that just makes you appreciate so much more what you have, and then appreciate being able to be out here to at least make a small difference. One guy was telling us, I mean, by the time he pays, his bills and he's got child support and like other things, I mean, he's left with like $70 for 2 weeks for food. I mean, it's crazy. So to be able to just do something for him and be able to help him was a great thing. Okay, even if it was just one patient, I mean, at the end of the day, that's still a win, because that's why we got into healthcare or doing what we do, is to help people and to make a difference.
Major Omar Nava, the officer in charge for the mission, has been in the Army Reserve for over 30 years and explains why this IRT mission is important to his unit and other medical support units like his.
I would rank this number 1. And sometimes people value taking an Army unit and setting up in a fixed facility somewhere else. Coming here and having to set up in a non-clinical environment and being able to impact the lives of people who are in severe need of the most basic health services, that's something that you can't recreate. So I would place this experience in terms of ATs as number 1.
As the IRT mission comes to a close, Brigadier General Marsiglia sums up the results of these missions for the Army and the community.
I think these are the types of missions we need to continue to do. It does truly build our readiness, and it enhances our relationships with our civilian communities. We want to show our communities that we live in what we bring to the fight. So I think that's a huge win. And as long as we have the ability to do these things, I think that it's important that we continue with this IRT missions.
At the completion of the North Central Minnesota mission, the 7218th cared for approximately 400 people and provided more than 2,550 different medical services. Cass Lake Indian Health Service and other community partners helped with follow-on comprehensive services for Leech Lake Indian Reservation tribal members and residents from surrounding communities needing continuity of care. Reporting from Bena, Minnesota for Army Reserve Medical Command, I'm Sergeant First Class Kenny Scott.